The neonatal period is known as the first month of a newborn's life. Neonatal nursing is a branch of nursing that works with newborn infants that are born with different varieties of problems, such as prematurity, birth defects, cardiac malformations, and infections. Neonatal nurses generally care for infants who experience problems right after birth, but neonatal nurses also care for infants who experience long-term problems that relate to prematurity or other illnesses after birth. Neonatal nurses care for infants until they are about 2 years old. Generally, neonatal nurses care for infants from the time they are born until the time they are able to leave the hospital. Parents, neonatal nurses, and other members of the healthcare team often use the best of interests of the patient standard when making ethical decisions concerning the treatment of the critically ill newborn. They also understand that families will need to assess what is good for the family as a whole when extraordinary demands are made upon them. Nurses are often the first members of the healthcare team to whom the parents express their wishes.
There are many different roles and responsibilities of a neonatal nurse that vary depending on which level nursery the nurse works in. In Level 1 nurseries, where healthy babies reside, neonatal nurses provide a minimal amount of care, such as feeding, bathing, and changing diapers. In Level 2 nurseries, where premature or sick babies reside, neonatal nurses provide an intermediate level of care, as babies in this level may need oxygen, intravenous fluids, or specialized feedings. In Level 3 nurseries, where very sick babies reside, neonatal nurses manage ventilators, incubators, and other special equipment sick babies may need. They also take care of babies who have undergone surgery. Other responsibilities of a neonatal nurse include giving babies correct doses of medication, which requires the calculation of a fraction of the dose an adult would need.
Neonatal nurses' salaries ranges from an hourly rate of $20 to $43. If overtime is worked, then it starts from $11 to $63. In entry-level neonatal nurses, the average salary is around $55,000 a year. For mid-careers, which is 5 to 10 years, it could go up $10,000 to around $65,000 a year. From 10 to 25 years, the salary then goes up another $10,000, which is around $75,000. And at late career, it could go up to a maximum amount of $80,000. The national average is around $62,000. The cities that pay the most is in Los Angeles and San Diego.
Dealing with parents in NICU. In the context of decision-making process for the critically ill newborn, parents require considerable assistance from the healthcare team to interpret and process complex information regarding their infant's condition. At times, the uncertainty of the prognosis may well make such interpretation even more difficult. Parents must be included in day-to-day decisions in order to develop an understanding of their infant's changing condition. They must receive the same information from each member of the healthcare team. Recent developments such as Parents on Rounds and the parent's medical record can assist in this effort. Parents may have difficulty identifying whether to continue or discontinue certain treatments. They also will need relief from the burden or liability of feeling they have the sole responsibility for any decisions made for their infants. For this reason, a team approach to decision-making that includes the parents, healthcare providers, clergy, and social work is the method most likely to satisfy the requirements of informed consent for infants who cannot communicate and whose best interests are at stake for all concerned.
In order to become a neonatal nurse, first you need to become a registered nurse. Then you need to have experience working around neonatal care, such as working with children or infants. Some schools offer internships or even jobs working at nurseries. After you get experience, RNs would have to get their master's degree in neonatal nursing. This process takes about 2 to 3 years. This helps the nurse prepare for situations in the delivery room, family practice, or intensive care.
To conclude, neonatal nursing is a very important field in the healthcare team. Neonatal nursing is a field that requires a lot of training and dedication because they need to be able to provide care and nurturing, which is very necessary for newborns.